My name is Victoria Karpay. I live in Tessan. I work as a community health assistant. I have worked as a community health assistant for 3 years. Before, we don't have clinic in this community. So whenever somebody is sick, near to get motorbike or car, it can be hard. So within our movement, the person can die or something can happen to the person. So as community health assistant, we are the middleman between the community and the health facility.
We know that illness is universal, but access to healthcare is not. And around the world, studies have shown that nearly 9 million people die every year from preventable causes because of lack of access to healthcare. Community health workers are known locally in Liberia as community health assistants. They bridge the distance between healthcare and the patients. They are recruited from their own communities. They are members of those communities. They are trained and they go from door to their neighbors, providing health services.
If I go to a hospital, I greet the hospital member, ask if there is sick child in the house, I lead that, I start my treatment. If there is no sick child, I give my health education. We select a topic like malaria, then I start telling them what can bring malaria, how we can do to control malaria, and what we can do for malaria to not come around.
So studies have shown that professional community health workers can help reduce child death, improve maternal health outcomes, and even help in the response of disease outbreak. And so in order for us to be successful, we need to treat community health workers as professionals. And so at Last Mile Health, we work to ensure that community health workers are skilled, they are salaried, they are supplied, and they are supervised.
Supervision of community health assistants is important because they need mentorship. They need to be monitored to ensure that the work is properly done. I have 8 community health assistants. So during my supervision, I go with them in the field and do patient audit because I want to know that they have given the best care. My community health assistant, Victoria Karpay, she is doing extremely well. She is even hoping to become a nurse. Sometimes when you refer the patients to go to the facility, they don't want to go. But she is always willing to go with them at the facility. She can become a nurse and also be a supervisor tomorrow. Since I started working as a community health assistant in my community, there have been no child death and no maternal death in my catchment area.
Since we were founded in 2007, we've partnered with the government of Liberia. And this is really important because the only way our vision of a health worker within reach of everyone, everywhere it's possible, is through a national community health program. In 2016, Last Mile Health was invited by the Ministry of Health in collaboration with other health partners to design and scale the community health worker program to put a community health worker in every remote community across the country. By June 2024, Liberia reached a full scale of the community health worker program. That means every remote community in Liberia has a community health worker providing services to their neighbors. And that has put Liberia on track to achieve the universal health coverage, which is an incredible milestone and a blueprint for other countries.
Well, I think Last Mile Health have been one of the critical partners working with the Ministry of Health. Over the years, we've seen that besides being that implementing partner, Last Mile Health have played a direct technical assistant role to the Ministry of Health, Community Health Services Division. And that have built our capacity in terms of managing the program. It have built our capacity in terms of ensuring we put the right policies in place.
We have 4,000 community health workers working across Liberia, and they have provided treatment to over 1 million people since 2016. They have also conducted more than 14 million home visits. We are proud of the work that we have done in Liberia, but the work is not done. We've been invited by Malawi, Sierra Leone, and Ethiopia to expand our work in those countries. We are partnering with them to strengthen their community health worker program. To date, Last Mile Health has partnered with governments to support more than 16,000 community and frontline health workers to serve over 19 million people across the 4 countries we work in. This work is important. It needs to continue. My call to action is to continue investing in community health assistants like Victoria. We need more of them, and we need to keep investing in them.
I feel great to be a lifeline for my community. What I find most rewarding is the respect, the trust, and the relationship with my community people.